what is smile depression and what are the symptoms of it?
Well, small depression and depression. First of all, depression is actually a clinically diagnosed disorder. So, and depression has many phases. So it comes to a different level to different people. And typically, a small depression occurs when a person are experiencing depression, but they're masking how they're actually feeling. So in other words, small depression is like a high functioning depression. So they could go on in their daily lives as how it is. They could be, work could be going very normal. They could be, functioning at a normal level. Life is going great. Everything is going great on the outside. But actually in the inside, they feel very similar to what depressive people experience. So they hide behind, so the small depression, like it says, they hide behind the smile to convince other people that they're actually okay.
Yeah, right.
Yeah, and the symptoms and signs are, of course, because they're smiling, they're less obvious as compared to depressive individuals, and they may seem positively happy and cheerful on the outside. But in terms of symptoms, they are difficult to track and difficult to see. But if you pay attention to it is very similar to depression. If you pay attention to how they're experiencing, say for example, changes in habits, if you are experiencing depression, you will see a change in habits, energy level, motivation level, and also of course a switch and change in the interest in terms of the things they like to do and the things that they enjoy. So very, very similar to depressions. The signs to look out for on the individual level. So say, for example, if you're experiencing it, is whether do you have a change in appetite, change in the sleeping pattern, your interest. Has been a shift in the interest, how you're feeling inside. So what you're experiencing on the inside is very much like depression, but it's just that they don't, in small depression, they tend to mask. You didn't show it. So the question is why, right? Why you don't actually, some of us questions why, some people who appear so happy, they can actually be so deeply saddened inside, because there is a sense of, burden. You feel burdened towards others. The embarrassment of what's going on. Maybe there isn't much awareness, which is why you're doing this awareness right now. And of course, denial. Maybe their life is going great. So their life is going great. Great family, great job, everything is in line. There's nothing to worry about. But like I said, depression has many faces. So it comes to you without a reason. So it could be this as well. And then the fear of backlash. Say, for example, if I tell my boss that I am depressed, I feel very sad in the inside. What will they think of me? Would I lose my job? So that
they look at me differently.
So that kind of fear that they have, the guilt. Also, usually depression comes alongside with guilt and the unrealistic view of happiness. Again, influence from the social media. So all this in a package explains what small depression is.
Okay. Next, what are some ways to prevent small depression and depression in general?
Well, depression, first of all, is the state of the mind. So depending on how the mind interprets information throughout your life experiences, you can be very vulnerable to it, especially if you're stuck in the same cycle or a prolonged period of helplessness, hopelessness, and sadness. So if you're stuck in it for a long time, then depression can come to you because of you feel stuck at that moment. And depression and feeling of sadness can appear for no apparent reason. Like I explained earlier, small depression is also asking, like, things are going well for me, why am I experiencing this, right?
Yes.
Some of the ways to prevent it is, of course, seek out for the right support. Whenever you feel that, the feeling inside of you, this sadness, helplessness, and hopelessness is consuming you inside, then seek out for the right support. Reach out for help. If you're experiencing it emotionally, helplessness and sadness for a long time, speak it out. Reach out to people around
friends,
you.
Yeah, friends and family.
Exactly.
Yeah.
Friends, families, even your teachers, your school counselors, people that you can trust.
Right.
Yeah, but even if there isn't anyone that you can reach out to who can really understand your problem, because the awareness is there are helplines available in nationwide. So there are NGOs that are reaching out as well. So there are a lot of helplines available to speak to the people behind the helpline.
Yeah.
And also keeping a positive, mindset. I think the idea is not to hit depression, then try to be positive, because it's quite difficult at that time, right?
Yeah.
So the key is to try and keep a healthy mindset. Make it a practice from now onwards.
To open up more.
Correct. Yeah, and of course keeping active. The mind and body are very connected in that way as well. So
encouraging dialogue with people.
Could
be anything.
Correct.
Just talk about anything.
Yes, correct. Just talk about anything.
Right.
Keep yourself active. Keep the conversation active. And of course, if you do exercises as well, keep your body, in that constant happy, motivated state. Exercise increases the serotonin level and decreases the cortisol. So, it works inversely in that way. So it helps clears the mind, then allow you to work out strategies, to help you cope better if you feel saddened deep within.
Do you think it is important that smile depression education and awareness should start from high school?
Actually, I think the earlier the better.
The earlier
right?
the better. Yes.
The earlier the better, right? I think
it's
even in children as well, in young children as well. If you have that awareness, you keep that in mind with you all the time, and then you can reach out for help as soon as possible. So the earlier the awareness, the better. If you're in high school now, great, that you have the awareness, but if you can reach out to someone that... Yes, correct. So you can also reach out to someone that is in the middle school or a lower secondary school, middle school, and share this awareness with them. I think they will find it very helpful as well, especially at this time where life is busy and we're just hustling around. So create that awareness, and also important for you to create the self-awareness inside of you. To get in touch with your own deeper emotions.
Learn about love yourself, learn about yourself.
Exactly. So self-care is important as well.
Yeah, especially now it's in the pandemic, in the middle of pandemic.
Of course.
The perfect time to have self-care.
Taking care. Yeah, correct. So with self-care, when we talk about self-care, it's not just about, physically taking care of ourselves, sanitizing. It's also about taking care of our mental health. A lot of reflection and a lot of thinking ahead of what, get in touch with your emotions. So that is also sanitizing in a way that is helping you to, to reset and recenter yourself.
Should mental health education be as important as other subjects in high school? Do you think it's in the same level as other subjects in high school?
Yeah. I would think mental health can be incorporated into physical health or physical education at high school, because when you talk about health, it's actually a holistic well-being. So it's not just about physical, it's about mental, emotional, social, and spiritual as well. So it can be incorporated into physical education. So if physical education is compulsory subject at high school, then I think mental health is just as important and as mandatory as physical education. So I think absolutely very important as other subjects in the high school.
Is smile depression or depression in general contagious?
Yes and no. So it's kind of like in between, but it's no, because it doesn't work like flu. where if someone has it, you catches it immediately. Like you can tell the symptom right away, right? So in that sense, then it's not like you can see the symptom of flu, like how you experience if someone has it, pass it to you and you experience right away. Rather, it's more contagious in the sense that it can affect your mood and emotion. Say, for example, if you watch a movie, a sad movie, you kind of like absorb that feeling in with you, right? So you also try to deal with the character in the movie, right? So it's almost like that. So you absorb the mood and emotion, and if for a prolonged of time you are exposed to movies like that, then that emotion actually stays on with you for much, much longer. And it's kind of like you internalize that emotion. So imagine if you watch a sad movie for the entire month, how would you feel? It doesn't affect you right away, but if you watch a lot of sad movies, for the whole month, then at some point also you feel like it's consuming you and it's affecting you negatively. So it is very slowly. But yet, and also it's just like, when you see someone laugh, you tend to laugh together with that someone. So also in that sense. So
it's the same, how do I say it? It's the same formula.
It's kind of like the same experience. It's like mirroring, right? But not all the time. So it's not all the time, but if you're prolonged exposure to, sadness for a long, long time, then sometimes it might consume you. And also it depends on the individual, on, how much you actually internalize these negative feelings. So some people, if they watch a sad movie, they don't actually cry. So they watch it and then they look at it as a story, and then they close the chapter. So they don't internalize these negative feelings a lot. But if you're someone that internalize a lot of negative feelings, then you want to watch. Then like I said again, you want to keep in touch with your emotion, your deeper emotions, to see how much is it affecting you. That's when you do the self-care, the self-check again.
For high school students, I think they should know what are the difference between a psychiatrist and a psychologist. So when they need help, they could go to the right people.
Can. So I know there's a lot of confusion. Sometimes you think psychiatrists or psychologists or even counselors or who are the mental health professionals, right?
Yes.
So psychiatrists are actually qualified doctors, who work with patients of mental illnesses. They are usually mental health trained, and they have a medical degree. So they have a bachelor in medical or MBBS. And usually they work in a hospital setting, a healthcare setting. And in Malaysia, in most of the countries, they prescribe medication to patients and monitor the medications intake. While they also actually simultaneously run psychotherapies. So they run interventions with your patients through psychotherapy work. So that's psychiatrist. Psychologists, on the other hand, they have a degree in psychology. They also have a master's in psychology. Well, psychologists are a little bit more wider in spectrum. So we have clinical psychologists, we have educational psychologists, we have health psychologists. So there are a lot of different specialty when it comes to psychology. So psychologists, they run more diagnostic tests with clients. We don't call them patients, but they call them clients. And they also practice psychotherapy work with their clients. The only major difference that people always notice between psychiatrists and a psychologist is psychiatrists don't prescribe medication. But having said this, they can work alongside with the psychiatrist, to run further diagnostic work to see whether medication is needed at the point of treatment or intervention. So workplace-wise, you could find them, in hospitals, healthcare settings. They have some private practices, and even like in Sunway, we also have a clinical psychologist who's trained. So you can find her in the educational setting